Hello, welcome. I wanted to quickly run through a wonderful technique called the ACE formula. And the ACE formula is essentially this idea of dropping anchor amidst the storm. When there's a storm with our children, our young people, our adolescents, we can use the ACE formula. We're going to acknowledge, we're going to connect with our bodies, we're going to co-regulate our young person, and we're going to engage. So ACE, acknowledge, connect with the body and co-regulate and engage. And this is just a very simple strategy that with practice becomes very easy, but at the outset can be really, really hard. And this is essentially what we're trying to learn in all of our parenting strategies, how to use our ACE formula. So the A is acknowledge. We want to notice and name quietly to yourself your own reaction. Are you tense? Are you tired? Are you frustrated? Maybe scared? Low in confidence? Or are you triggered right now? So we're acknowledging. We want to notice and name your child's response. So we're noticing what's happening for us, and we're also noticing what's happening for our child. So with our child, when we notice and name their response, we're going to say, I can see or I can hear that you're upset, or I can hear that you're angry, or I can see that you're scared. I can hear you're worried. I know this is hard. I know this is tough. I know you don't like this right now. They're all examples. So again, we're noticing what's happening for us. I'm tired. And we're noticing and naming for our child what's happening. I can see that you're upset right now. And then we want to communicate simply. We just want to try our best to be calm yet firm with our nonverbal body language. The second step in ACE is we want to connect with the body and co-regulate. So we want to continue acknowledging and bringing your own regulation. Okay, and by bringing in our own regulation, we're dropping anchor in our own body's emotional storm, particularly the expressions on our face, our tone of voice, and our body language. So, for example, push your feet into the floor. Take a few breaths, soften your face, open your posture, relax your body as best as you can, and move your body to get the best chance of eye contact. So with little people, it might be getting down low. I often get quite low. I don't want to be big and powerful and over the top of them. We want to be able to, be maintaining that eye contact, and we don't want to be frowning, so we want to be opening our body up because we don't want to look angry. And we're just going to stay as relaxed as we can, because by doing that in our body, we're showing our child and we're co-regulating, and we're dropping down for them what's happening with them. Because what we're doing is we're finding a window of openness and inviting your child to do the same with us, so we can connect to their body and connect it in the present moment. And then we front load what will happen next. I can see you're hurting. Look at me and let's take a breath together. I know you're scared. You're doing really well. We're okay. You'll be okay. Let's pause and get calm together. When you're ready, we're going to do blah, blah, blah. You can have XYZ minutes to do XYZ, and then we're going to calm down and do something different. You don't need full regulation with your child for this next part, just enough of a window of tolerance to help them transition into the engagement of the desirable activity, okay, whatever it is that we're wanting them to do. So full regulation can reinforce the purpose of the distress, so we want to just really connect with our young person. And then the third part of this ACE formula is engaging. So we want to invite the child to do their own problem solving for further regulation, or move them into the transition of the task they're avoiding. So how do we do this? We acknowledge. We acknowledge what's happening for us. I'm feeling really tired right now. And we acknowledge what the child needs to hear. I can see you're really upset. We're then going to connect with our body. We're going to relax our body. We're going to get to our child's level and we're going to say, I can see that you're hurting. Look at me, let's take this breath together. And then we're going to engage by inviting the child to do their own problem solving. How can we fix this? How can we make this okay for you? And then we want to move them on. So guys, that's the ACE formula. And to be able to do that well, you need to have some pretty solid parenting skills, and you want them in your bag of tricks. And the best way to build a bag of tricks is to have some really good parenting support. And where do you go to get that good parenting support? Well, for the families that I work with, they love to go and download my online courses because it's a really cost-effective way to get several sessions of input. And then if you need extra on top of that, you could make contact with a really great psychologist that you're comfortable with. Remembering you can access most psychologists now via Zoom sessions. I spend 2 of my 5 days of my work week on Zoom doing a lot of parenting support. So feel free to reach out to me if you need some extra input with this. Take care. Bye.